I'm Dr. Grace NG. I'm a brain health specialist and I'm proudly part of the endota wellbeing conversation. With a background in IT and neuroscience, I'm here to help patients understand their brain better and apply modern day technologies to better improve their brain function. In this conversation, we'll break down how mental fatigue and emotional overwhelm show up neurologically. We'll explore how burnout develops in the brain, how people can recognise the signs, and what practical strategies help support recovery. Burnout's an interesting neurobiological phenomena. It's a nice word. Essentially, the brain has a thermostat, and the release of hormones in particular that come out of that include something called cortisol. Cortisol is pumped into the system, and there's two particular areas that are very sensitive to it. You have the prefrontal cortex, which is usually your executive control center. Think of it like the captain of the ship. And then you also have the amygdala, which is your fear center, as you would mostly recognize it as, more like an alarm system on a ship. When you have burnout, you're in a situation where there's kind of hyper-cortisol state, this increased amount of cortisol, is causing the captain to be overwhelmed. Too many signals are going off because the amygdala is going nuts right now. Really loud signals coming in, overwhelming the executive center's ability to kind of discern what is core and what is essentially a reactionary kind of situation. With burnout, your thermostat's being overwhelmed, your executive function or your captain kind of losing control of the ship, your emergency system takes over the brain. And you can see that in a number of the symptoms that you exhibit. Some of the cognitive, emotional and physical signs of burnout that you'd recognise, doesn't apply to everyone, includes emotional dysregulation, sometimes considered also cognitive fatigue. So that might be anything from memory patchiness, brain fog that might set in, to emotional lability. That irritability, sometimes you're on, sometimes things don't irritate you, and sometimes it just annoys you immediately. Some people experience what is termed sympathetic overdrive, that feeling like you've just raced across town, or you've run a million miles. Palpitations, that inability to sleep, lying there and just willing yourself to try to rest, but you really just can't turn your brain off. A lot of people describe it as essentially that feeling of being wired. What are the modern challenges that we essentially have contributing to burnout now? Well, there is most definitely that cognitive overload, and speaking to any woman in their 30s to 60s, and not excluding the 20-year-olds either, but we do so much personally, professionally, socially, emotionally, and carrying all of that. Your executive centre, that overwhelm that we were talking about before, the captain essentially getting so many signals going. We have so many ways of communicating, contributing, committing to things that you feel pulled in a lot of different places. There's something called the lymphatic system, which, if you can believe, I was never taught about in med school because they only discovered it in the last 15 years. The lymphatic system is the lymphatic system of the brain. It activates during deep sleep, particular phase of sleep, and essentially it's the garbage taking out collection time. So all those waste proteins, all the stuff that you hear when they talk about Alzheimer's and other neurodegenerative diseases, there is a mechanism to get rid of it naturally, and that happens during deep sleep. The digital stimulation, the ability to take what is effectively a computer into bed or the internet into bed, and as you lay there, have the entire world just stimulate your amygdala and your dopamine so that you essentially have this high adrenaline, high dopamine soup that you're essentially trying to then relax your brain in. It just doesn't work. You're fighting against hundreds of thousands of years of evolution, and here's your brain with this new thing, this new dopamine and adrenaline kind of soup that it gets to addict itself to. And of course, it's really, really challenging. A question I get asked all the time is, can you rehabilitate a burnt out brain? Yes, you can. It's a little involved. There's 3 steps. We talk about top down, bottom up, and the metabolic component, the substrates that make it happen. There's a top-down mechanism that you can use that is essentially stimulating the prefrontal cortex. We do this in our clinic, and what it does, it allows the prefrontal cortex to receive stimulation, maybe stimulation that it has lost connections through burnout, especially if it's been chronic. We also talk about a bottom-up connection, and that's because essentially what we're trying to do is a brain-body reconnection of sorts, grounding people. So that might be through meditation or yoga. Box breathing is a really easy way in order to just do that at home. Learning essentially how you gain that sense of connecting back to your body, checking in with yourself. The final one, and it's the one that is often compromised, especially in the case of mental health disease or neurological disorders, especially those affecting your gut as well. And that's the metabolic component of your recovery. You need the ingredients, the foundation blocks, in order to make sure that you can lay down some really nice new tracks for your brain to essentially run on. We talk about train of thought. Those tracks are being built top down, bottom up, but also through the stuff that you're eating, the stuff that you're digesting and consuming, information that you're putting inside your head as much as it is the food that you're putting inside your body. Understanding how the body works helps us care for it more intentionally. Explore more simple ways to support your health and longevity with the Endota Wellbeing Conversation.